and your budget. Call 1-855-201-6784. That's 1-855-201-6784. Or go to GetCignaMedicare.com.
This year's Share Your Christmas Food Drive will be December 11th. We hope you'll watch. To donate this year, go to any Food City or Walmart store to buy food that will be sent directly to the food bank. You help our hungry neighbors. You can also give online or by text. The Channel 3 Storm Alert Team, weather coverage you can count on.
Okay, we are so happy this morning, I am anyway, to be outside with Jay Fontana, Misty Anderson of Medicare Misty, and they are so dedicated to what they do and helping you that they have braved the cold to share some time with us. So good to see you both.
You too. You too.
Y'all are kind of like accountants at tax time, right? You're on the final countdown.
Yeah.
Open enrollment ends when, Misty?
December 7th. Yes, next week.
So is it typical for you that you'll see people coming in kind of last minute? It just sneaks up on everybody?
Yes.
Well, it doesn't sneak up. It's sometimes people just are still waiting to make that decision. They'll hold off till the last minute.
Okay,
so.
talk about the decision part of it, because that's part of what you do, right? I mean, you're experts in your field, but you're also kind of counselors. You guide people on what they need to be watching for.
Absolutely. Right. And, you know, that there's extra help available out there, and they don't realize that they could get help on prescriptions, you could get help on your co-pays. A lot of commercials are out now about the Part B premium being paid for. So a lot of people are asking, how do I get that Part B premium paid for? Because there's plans out there that are available that can help pay that.
So the way this works, you'll have to refresh my memory a little bit, but if you are 65 or older, if you're turning 65, you have 2 months, is it, on either side of your 65th birthday? 3 months.
Yeah.
Okay. So
you have a 7-month total.
So what happens if you miss the deadline?
Well, right now, if you miss the deadline, you have a supplement, then you're stuck with that supplement and that drug plan till next year.
So does it mean that you're paying more money, or just that your options are not as great?
Well, if you're turning 65 and you don't get it in within that 7-month window, you will have late penalties for your Part B if you don't get that, or your Part D if you don't get that during that time.
Okay, so how much of a teacher are the two of you? Because you're talking about Part D and Part B, and most of us know those terms, but we don't know what they mean. So when they come to meet with you, is it important that they have some education prior to sitting down, or do you tell them all that once they're with you?
We help them.
Yeah.
I mean, usually they don't know. They try to do their research, and where they pull their hair out. They're like, I'm done. Help me through this maze of, you know, what's better. And one of the customers said, I think yesterday, was, I keep getting all this stuff that everybody's the best. Tell me we're the best. And I think that's where it helps, because they're getting all this mail from several different companies, and I don't know which way to go, and they're scared to go the wrong way, plus the COVID and, you know, all that other stuff that's just made it a crazy year.
Okay, let's talk about COVID, because you're both very personable people. So I know you love being face-to-face, but many of your customers are probably fearful of that right now. So Can they talk to you remotely?
Yes.
They can. And I was just telling Misty in the car that I had several yesterday that had to cancel because they thought that they might have been exposed. So I can either do FaceTime or Zoom or just on the phone. A lot of these companies have made it now where you can just sign up by, you know, calling into a phone number and after we talk to them.
Okay, what if both you and your spouse are newcomers to Medicare? You're both turning 65 this year. Will you both get the same plan, or might one spouse go one direction and one spouse go the other?
I've seen it both. It depends on what their medications are, who their doctors are, and what kind of coverage they want. So each need is different. Some couples like to do the same thing, and then some others want more, and, you know, some want to pay less. So each is different. They don't have to have the same coverage, which is nice. They can, you know, we can make sure that we get what they need and fit it to their needs.
Okay, I also think that, and this will be a fair concern maybe to have, that people think, yeah, I'd love to call them, but I don't have the money to pay somebody. They're not paying you directly.
No, absolutely.
We get paid when we sell something, and we get paid through the insurance company. So, I think a lot of times people are afraid that they're going to have to, you know, pay us, but we need to let them know we don't charge anything for any of our services.
If you are 78 So obviously you've had Medicare for a while. What are some reasons that people might think they ought to come in to you to consider changing their plan because of a health condition? Or what are some reasons
I think
to
the
switch?
big thing is prescription drug plans are changing so drastically every year. So you want to just make sure your prescriptions are covered every year, make sure your physicians are covered every year. And if your price, what you're paying is too much. You know, Jane also was a teacher, which is kind of nice. So she breaks it down to the level of, you know, teaching you and not making it feel so overwhelming. And I think that's what everybody's scared of, is what we hear, is that, you know, it's just so overwhelming. Am I going to be able to understand it? You know, I'm trying to figure it out now. And every time they leave our office, they always say, you know, you simplified it. Thank you. It made this decision a lot easier.
Do you get information that you can take home and actually read, like papers in your hand, not just sent to a website?
Yes.
That's big.
Yes, we can give them, we have, in Misty's office and in my garage, we have a huge amount of books that they can take. And we also have the digital where we can send it, like I said, during COVID, I've sent a lot to people just through the mail. So we try to make it work for them.
There's nothing like having that piece of paper in your hand, though. You want to be able to look at it and highlight it and make your notes in the margin.
Absolutely.
Okay, so December 7th is the deadline. How do people, what's the best way for them to reach you, and how late can they reach you?
Midnight.
Well,
my agents are probably like,
Actually, 11:59.
yeah, okay, sorry, 11:59.
I mean, in terms of the
it.
day, like, can they get in touch with you on December 7th, or it has
Yes.
to be prior to?
We would have liked it to be, but we're getting down to the wire. So yes, we'll take calls. We'll try to help everybody that we can. And you can call our office at 423-777-5577, and we'll get you some good help.
I'm telling you, I've known Misty a long time, and Jane doesn't take long to know her before you feel like you've also known her for a long time. So they will definitely guide you. They won't make you feel hurried at all. And look how dedicated they are. Misty's out here without a coat on a freezing cold day. Go get in your car and warm up.
Thank you so much.
Thank you, Julie.
Millions of customers are leaving their providers and switching to Spectrum. And if you have satellite, it's not hard to see why. Because unlike satellite, Spectrum